Hello everyone, welcome to my channel. Myself Dr. Megha from Homeopathic Clinic. Today in this video I'll be talking about one of the most used homeopathic medicine, that is Peptasia, which is mainly used for the typhoid fever. Okay, some people think that homeopathy medicines are very slow, but it's not like that. It's not slow, but we cannot give the homeopathic medicines in the emergency cases, that's all. We have that kind of limitation, but emergency medicines are really should be treated very immediately, so you should be seeking the help from others. But when you consider like fever, stomach pain, headache, or cold, coryza, or any kind of acute symptoms, of course it can be treated, because so many people think that okay, it's just a fever, homeopathy does not have medicine for that, or homeopathy is very slow so my fever goes up. No, it's not like that. So today this is one of the wonderful homeopathic medicine which can bring down the fever from 108 degree to normal. Okay, today we'll be talking about Peptasia. So only in the introduction I talked about how homeopathy works. It's not slow in action, it's very fast actually, but it also depends upon the disease. Means if you have got fever, of course you got it 2 hours previously, right? So it can reduce within 1 hour. But any kind of chronic diseases like eczema or psoriasis like that, it took years to come outside, and it took years to come for you to notice that, and it also took years to come and approach the doctor. So that kind of duration is there. Because of that, the treatment duration also extends, that's all. Moving on to the Peptasia, we also call it as wild indigo. Common name is wild indigo, and Dr. Nash has been introduced this wonderful remedy for all of us. And Peptasia is generally indicated for all typhoid fever, and if you want to end typhoid fever correctly, means you should also keep in mind that gelsemium should be given after the end stage of treatment. Okay, if you are an homeopath and you are also watching my video. Peptasia patients are very chilly patients. Moving on to the keynote symptoms of Peptasia. All means the patient will be so much in a weak state, exhausted state, and discharge of the body will be very much offensive. Even the breath, stool, urine, sweat, uh, any kind of ulcer, boils, anything is really kind of smelly, offensive. And that is one of the peculiar symptoms of Peptasia. Of course, you cannot give the Peptasia for all typhoid fever. That is also indicated. Means 2 to 3 medicines are there for typhoid fever. We should just rule out. Means the offensiveness is there or what, or any kind of symptom is matching or not. Because the lacasis is also given during typhoid fever. Gelsemium is also given, and Peptasia is also given. So you should rule out which should be given. That's all. Great prostration with disposition is also seen. And how will be the tongue? This is one of the peculiar symptoms of Peptasia. The tongue in the beginning will be coated white with red patches, and later there will be dry, cracked, and ulcerated tongue. This is one of the peculiarities of the Peptasia. Moving on to the face, flushed face will be there, and dark red with darkness expression will be there, and it is also seen in gelsemium also. The patient always falls asleep while spoken to or in the midset of the answer. Okay, moving on to the mind symptoms of the Baptisia. The patient is not able to answer the question. They always falls asleep when spoken to or in the midside of his answer. Cannot go to sleep because the head and the body feels like it's been separated, and they always think that they wants to go and collect the pieces and make it together, feels that he cannot get them together and cover them up. Because of that, he always likes to cover. This is the mindset of the baptisia patient when he is suffering with the fever. You should be really kind of considering it, and you should be really looking into that, because the patient, when you are asking the question, the patient is not answering you, and you're finding it repeatedly. Means if you ask, okay, from when the fever has been started, he says from yesterday, that's all. He does not finish up the uh, question or the answer. So that kind of thinking. And he also kind of says that, doctor, I think that I'm not one, it's been separated, I cannot find my leg, like that. He will be kind of muttering, he will be in a delirium. Moving on to the typhoid fever symptoms. Baptisia is suitable for typhoids that come on rapidly with remittent fever all at once. It turns and takes as septic symptoms also. Look of the patient. How the look of the patient is? Patient looks as if he is drunk. He has a very dark red flushed face will be there. Purpleness is also seen on the face. Moving on to the delirium. How the delirium is there in the typhoid fever? The patient is in an confused state. I already said that. He always says that I am in a confused state. Falls asleep in the midset of his answer. Even if you ask one direct question, one simple question, what you had for morning, he does not even remember it. He will be always confused. No, I had idli, I had dosa, I don't know, I drank milk. He does not answer. Cannot collect himself, means he always feel that his body parts is being scattered in the bed, and he always try to get them together. Because of that, he will be always covering up the blanket, and he says that, okay, if I cover the blanket, I'm not going to get scattered. And he also says aversion to the mental thinking and disposition to think anything. And the parts always feel sore and bruised. High temperature ranging from 103 to 106. Afternoon rise of temperature is also seen. And moving on to the diarrhea symptoms. What are the diarrhea symptoms of the baptisia? Anus is ulcerated. Because of that, there will be so much of pain, burning, rawness, and also sometimes there will be bleeding. And how is the stools? Stools are involuntary stools and involuntary urine, dark brown, and sometimes it's mucus mixed, and sometimes it's also bloody stools also. So if you're thinking of baptisia and you are feared given baptisia for fever, the fever has come down, then you give 1 dose of gelsemium, the same potency which you had given. Means if you had given baptisia 200, or if you had given baptisia 30, go with gelsemium 30 only. Give 1 dose, because it removes the exhaustion which was caused due to the fever. So to remove that exhaustion, you should be just giving that, that's all. 1 dose of gelsemium, same potency. Okay, myself Dr. Megha from Homeopathic Clinic. Today in this video I have explained about typhoid fever and what are its symptoms, and what are the things you should be looking into the typhoid patient when they are suffering with the fever. And the wonderful remedy in homeopathy is the baptisia. So I think this video was very helpful. Thank you. Please do like and subscribe, and have a fantastic